Hi guys, thanks for watching my videos. My name is Dylan. If you guys are new to this channel, welcome and thanks for watching again. I am 9 months and 2 weeks post-op from pudendal decompression surgery. It's a rare and controversial surgery to treat pudendal nerve entrapment syndrome, which is a debated medical diagnosis in the pelvic pain community. The pudendal nerve is the main nerve branch of the pelvis. You have both a left and a right-sided pudendal nerve. The pudendal nerve comes from the sacral nerve roots S2, 3, and 4, and it branches off to control the entire pelvic floor. It is one of the main branches, like I said, and any issues with this nerve branch can cause a lot of three-dimensional havoc in the pelvis. Rectal, tailbone, genital, bladder and bowel issues, and a lot of different types of pain presentation. For 7 years, I was struggling with left-sided pudendal neuralgia, stinging, stabbing, burning, shooting, pretty much constantly throughout the day. Sometimes the pain changes presentation. My particular pain is based off of my intestines and my digestion, and whether or not there's a lot of pressure coming from the intestinal area. In my medical journey, I have discovered a lot of other contributing factors to my pudendal neuralgia. However, in March of 2020, I underwent PNE decompression surgery, which is a very extreme and controversial treatment for pudendal neuralgia. A lot of people consider this surgery when all other options has been exhausted. I did injections for years, physical therapy, diet changes, chiropractic. I spent many years ruling out other conditions, other ailments, did a lot of imaging, saw at least 50 different specialists to determine that I had a pudendal nerve entrapment. There's really no good way to tell if your pudendal nerve is compressed or entrapped. Some people say that MRN, magnetic resonance neurography, is a good way to tell. It's a fairly new imaging system that images nerves and soft tissues a lot better than a regular MRI does. The other way people sometimes get to diagnose the pudendal nerve entrapment is through Doppler scanning, which is more kind of used in Europe, and you have to really go to a radiologist or a doctor who knows how to interpret the results, which is another very, very hard thing to do. If you're in the United States, you have an issue with this nerve branch, you most likely will be traveling. My diagnosis was, I was diagnosed based on symptoms alone, and the way of onset is another factor, as well as symptoms, obviously. So it's been a long journey for me, and a lot of people ask me, should I have pudendal decompression surgery? What should I do if I have these issues? And you really have to follow a protocol of ruling things out and essentially building a medical resume before you even can qualify for a surgery like this. I spent, like I said, 7 years building a resume of ruling things out prior to flying to Arizona to undergo this surgery. The surgery is a very long and miserable year. Nerves take the longest out of any body part to heal. Your body prioritizes healing in a variety of ways, nerves being last on the totem pole. So I had the scar tissue cleared from my pudendal nerve. There was a lot of scar tissue and nerve damage, measurable nerve damage. So this nerve may never heal for me because of how long it was entrapped and how much damage there was. However, I have talked to several people that have underwent this surgery that say it can take up to 2 years to feel any type of difference. The differences are not gradual. You're not going to have a gradual improvement of symptoms. You're going to just feel a change in a short amount of time. Again, my medical journey has kind of gone in different directions, which should have been ruled out prior to surgery. However, there's not very much education on genetic conditions that may affect pain presentation and stuff like that. I had discovered that I have Ehlers-Danlos syndrome, which is a genetic connective tissue disorder which causes hypermobility of organs, joints, ligaments, blood vessels, and makes people more prone to nerve entrapment issues, musculoskeletal issues, gastroparesis, dysautonomia, a bunch of other systemic body issues. When my pain started in 2013, I had a couple of red flags prior to the nerve pain starting that kind of led me to believe that something was wrong with my body. I always was different. I had post urination pain, I had post bowel movement pain, but all of that type of pain would subside, and I never really felt or experienced neuropathic pain to the degree that I did until 2013 when I had a pelvic floor muscle spasm that resulted in nerve entrapment due to an episode using a vibrator. And I am starting to become more open with the onset of my injury. Before, I was sort of not really very direct about how I obtained this injury. And people with Ehlers-Danlos syndrome are very prone to injuries in all types of body parts. And since there's not a lot of education on Ehlers-Danlos syndrome out there, people with EDS don't necessarily know that they have it, first of all. And even if people who know they have EDS do not, they don't talk about the sexual aspect of the disease. And unfortunately, we are prone to getting injured in ways that are very unconventional, and ways that are embarrassing to talk about, and ways that evoke shame and fear. And unfortunately, it hasn't been talked about as much as it needs to be talked about thus far. But I have met a lot of other folks with Ehlers-Danlos syndrome that have obtained injuries in sort of the same manner as me. And I know that I am not alone. And I know that once more education is out there about Ehlers-Danlos syndrome, that more people will be talking about ways to protect the body, ways to move and exercise and live a normal life without disposing yourself to injury. And I really wish that I had known what I knew then, what I know now. However, there's no going back. My main goal on this blog is to raise awareness of Ehlers-Danlos syndrome and pudendal neuralgia, as well as pudendal nerve entrapment syndrome, and to reach as many people as I can. The other aspect of this horrible genetic condition is that we are more prone to vascular compressions like May-Turner syndrome, Nutcracker syndrome, and pelvic congestion syndrome. It's basically a mechanical compression of blood vessels that also cause issues. I am waiting for the results of my genetic testing to determine which type of Ehlers-Danlos syndrome I have. Some of them are more severe than others. The most severe form of EDS is vascular EDS, in which people with vascular EDS are prone to arterial ruptures and organ ruptures, more so the intestines and the uterus, the hollow organs. And if a person has vascular EDS, a lot of times they're hospitalized and nobody knows what's wrong with them or what to do with them. So it is super important to have the diagnosis and the awareness of vascular EDS, so that if something were to happen, the care team is prepared to deal with somebody with this condition and prepared to help and operate in the correct way. Because once you fix one arterial rupture, it tends to be like a chain reaction, and more of them keep coming and coming. So I am 9 months and 2 weeks post-op from pudendal nerve entrapment decompression surgery. And had I known that I had Ehlers-Danlos syndrome prior to PNE surgery, I may have made the decision to not undergo this surgery. However, I do think it was obviously a learning experience. I never would have learned what I have learned had I not undergone this surgery, and my nerve was extremely damaged and there was a lot of scar tissue around it. And this nerve is still very highly reactive. I have not noticed any change in terms of symptoms. I still deal with stabbing, shooting, stinging, burning episodes of pain, the entire left side of my pelvis, more particularly after bowel movements. That's the main trigger, or depending on food moving through my digestive system. With Ehlers-Danlos syndrome comes organ prolapsing, and sometimes this type of prolapsing is not visible on imaging because you don't catch it at the right time, you're not in the right position. And I know I'm dealing with bladder and intestinal prolapsing, which is probably setting off a whole variety of nerve issues as well as pudendal neuralgia. So there's a lot of mechanisms that can cause this type of nerve pain. And the good news is the Ehlers-Danlos Society has raised close to $1 million with donations. They're trying to find a genetic marker for one of the 14 types of EDS that doesn't have a genetic test at this moment. So hopefully with research, we'll have different genetic testing available, we'll have treatment options available, we'll have more education from doctors. And I'm hoping that in my lifetime, nobody has to go through what I went through. No child is left to wonder what's wrong with their bodies, is left to deal with bizarre symptoms by themselves. Both my mother and myself have Ehlers-Danlos syndrome, and we were both left to deal with mysterious symptoms without any answers. Doctors were never able to provide answers. And with more education, especially within families that have EDS, most of Ehlers-Danlos is autosomal dominant, which means all you need to have is one parent that has EDS, and you have a 50% chance of getting EDS. A child has a 50% chance. So hopefully children out there with EDS can know how to protect themselves and how to live a normal life, and we can help everybody out there that has EDS. And everybody wears EDS differently. Some people deal with neuropathic pain, some people deal with extreme joint pain, some people deal with digestive pain. Every single body system is affected by defective connective tissue. Connective tissue surrounds every vertebrae in your body. It surrounds every organ in your body. So any type of vulnerability in the connective tissue can cause a lot of havoc, and it's usually a domino effect chain reaction. So that's it for this video. Thank you for bearing with me. I will keep you guys posted. I am supposed to receive the results of my genetic testing sometime end of January. So I am very much looking forward to that, ruling out Ehlers-Danlos syndrome, Marfan syndrome. There is a bunch of different connective tissue disorders that haven't been ruled out in my case. So thank you again for watching, and until next time, take care of yourselves.